Hello, my name is Joshua Bell, and today I'm here to talk to you about physician-assisted suicide. Now, generally, when we hear the term suicide, we think of it as a bad thing. We do everything in our power to stop people from ending their lives and to increase our lifespan because we fear death. Um, we may try expanding our lifespan by the use of medications or um, surgeries or nutrition or even exercise. But eventually, it's inevitable that each and every one of us is going to die. Uh, some of us are going to die an agonizing and painful death. But there is a way to stop that, and that is through the use of physician-assisted suicide. Physician-assisted suicide, also known as physician-assisted death or physician-assisted euthanasia, is when a physician or medical practitioner dispenses a medication to a terminally ill patient in order to end that patient's life. This is usually a last resort and only given to the patient when traditional methods of treatment do not work. Many people say that it's not good to end a human life, but what happens when living is worse than dying? These patients are suffering daily, and every day or every night they pray that they won't wake up because they're in so much pain or they're constantly nauseous. They're losing who they are. We all have loved ones, and we want them to stay around with us forever. But think of grandma and grandpa. I mean, what if one of them come down with cancer or Lou Gehrig's disease or Alzheimer's? They'll be suffering, and there'll be no way to stop it without physicians-assisted suicide. According to Timothy Quill, a patient should have a right to control the circumstances of their own death and determine how much suffering is too much suffering for that patient to handle. Some people say that it's wrong to kill in no matter what, and that a physician's integrity is to help a patient and never harm them. But what happens when all the medical treatments that the patient receives is not enough and they're just in pain and suffering? The doctor needs to help end the pain and suffering, and that's where physician-assisted suicide comes into play. According to CNN, physicians-assisted suicide is legalized in Oregon, Washington, California, Vermont, and Colorado, as well as it's legal in the Netherlands. In Oregon, they have something known as the Death with Dignity Act. And the Death with Dignity Act is a very strict act that allows patients to receive physician-assisted suicide from their doctors. According to the Death with Dignity laws, it allows for mentally competent patients who are terminally ill and have less than 6 months left to live to receive a medication that will inevitably end their life. These laws are so strict that they require 2 witnesses and to be approved by 2 different doctors. The patient has to be mentally sound, and both doctors must agree that the patient has only 6 months or less to live. Some people may say that allowing physicians-assisted suicide is a slippery slope, and that if we let doctors end the lives of their patients, then this could happen on a widespread scale. But according to Kevin Drum, uh, since Oregon's Death with Dignity Act took in effect in 1997, the state health officials have published annual numbers and reports for the numbers of assisted suicides and also the number of medications that were dispensed to promote the assisted suicides. And according to these studies, in 1998, only 24 people received these medications and only 16 people took them. And then in 2014, after 16 years of this law being enacted, 155 people received these prescriptions and only 105 of them used them. This is 105 deaths by physician-assisted suicide out of 34,000 state deaths total. So you can tell that this isn't something that's just going to explode and going to become a problem. It's helping those who can't help themselves. And I personally think that it's our responsibility and the doctor's responsibility to treat a patient all the way through their life, even into their death, to provide them comfort and a good way out. I hope you learned something from this presentation, and thank you for watching.